Hi, I'm sure at some point you've thought about whether you really need health insurance or not. And today I'm going to tell you why we all need health insurance policies. Let me tell you the story of Anandhi and Hari, who are a young couple in their 30s. Anandhi was very health conscious and constantly focused on nutrition, and Hari was a fitness enthusiast. Both of them believed that because they were leading healthy lifestyles, there wasn't really a need for them to have a lot of insurance. And their respective employers had given them both a policy of 2 lakhs, which covered them as well as their parents. Now their careers were going on successfully year on year, they were getting promoted, things were going very smoothly in their family until Anandhi's father fell sick. So he initially started complaining of abdominal pain and he was a bit nauseous. And when they took him to the doctor, the diagnosis was pretty serious. He needed a liver transplant, and the family was completely shocked because there was no history of alcoholism or any sort of indication that her father was seriously ill. And while they were combating this emotional shock, they also realized that from a financial perspective, this was going to be a very difficult time for the family. The liver transplant surgery would cost anywhere between 35 to 40 lakhs, and they just didn't have the financial capacity to deal with that. So after a lot of effort, they had come up with an action plan on how they were going to fund this expense, and this is what it looked like. Totally, they had about 5 lakhs of insurance because Anandhi's father had an old policy of 3 lakhs and her company was going to sponsor them for 2 lakhs. Then, after talking to a lot of friends and family, they were able to raise another 9 lakhs from those sources. And they dipped into their savings pot of 10 lakhs. And the balance, almost 10 lakhs, they had to take a personal loan because there was no other way they would be able to meet the expense. And they also wanted to go ahead with this, right? It wasn't a choice for them. Now, this was only the first part. The second part was when they went through this entire experience, they realized so much about health insurance and the medical care system that it was really eye-opening in terms of what they didn't know from before. The first thing was that obviously a 5 lakh policy was just not enough for anybody because their medical expense was so high. The second thing that they realized was that there's something known as a network hospital. So Anandhi's father got treated in a non-network hospital, which meant that instead of the insurance company settling the bill right away, they would have to pay out of pocket and then claim a reimbursement from the insurance company. The third thing that they realized was that the entire claim didn't get settled because the policy that they had was not so comprehensive. And the last thing that they learned from the entire exercise was that non-medical expenses aren't covered by health insurance policy. So this applies across the board. So things like injection costs or bandages aren't treated as medical expenses and your policy is not going to cover them. Now, Anandhi and Hari's key takeaway from this entire experience was that everyone needs health insurance. It doesn't depend on how healthy you are today because medical emergencies can strike anybody at any time, and it's definitely worth spending those few thousand rupees on a policy for the few lakhs of cover that you're going to get. It was too late for Anandhi's father to get covered by a medical or a health insurance policy, but it was not too late for them, and they decided that they were going to insure and be sure. If you or your family have gone through a medical emergency, then financial planning can help you set your finances in order again. And if you've not been through a situation, prevention is better than cure. So get your financial plan today. You can email us at info@ithought.co.in or drop a comment on this video and we'll get back to you.